Okay, so I'm supposed to be giving a little bit of an overview before we start this morning, and I'm already behind, so I got to talk fast. So I want you to know who plans the WCLN conferences, and that is the fact that we are a collaborative network between the State Lab of Hygiene and all of you in the state. LabTag are the representatives that help us with all this planning, and we rely heavily on them. We do kind of a needs assessment each year when we have an annual meeting with LabTag in the fall. We get together and talk about what are the things that are really impacting labs, where they could benefit from some education. Another time for hands up where there's an open seat next to you. We have somebody. Okay. So based on LabTag members' own experiences and then also the evaluations that you fill out, we go and decide, what the topics are going to be for our educational events for the coming year. And we do work really hard on diversity. We have labs of different sizes. Obviously, we have small rural labs, we have really large healthcare system laboratories, and we have those in between laboratories. And you all have different needs, and sometimes it's really hard for us to try and meet the needs because they are a little bit different, but we do try to take that in consideration when we're planning these events. Because the goal really is to elevate all laboratories in the state. We want to make sure that as things change, challenges come up, technologies change, that we don't leave anyone behind, that you never feel like you're alone and you don't have anyone that you can help you through those kinds of changes. And so that is really what the goal is here. The topics that we focus on, due to the frequent changes in antimicrobial susceptibility testing, AST tends to be something that we focus on just about every other year to every third year. We realized that things were changing rapidly, and microbiology from the old culture-based system, when I left the clinical laboratories, that hadn't changed in pretty much all of the time I was working in the laboratory. Suddenly we had new technologies coming in for microbiology that was allowing our work to be done faster, and it was more relevant. So we started in 2009, and there were 11 laboratories that presented information on molecular testing that they were doing at that time. Then in 2011, we continued on discussing different molecular platforms. So we asked people to come up and talk about the platforms they were using, and we started talking about MALDI-TOF. We discussed pros and cons of the different platforms, the equipment. We talked about how you're going to validate and verify what QC and PT was available, and we also had a sales pitch. How do you sell this to your administration? In 2013, we brought quality into the picture. We really wanted to make sure that we weren't just doing new testing without making sure that it was high quality testing. We were really providing the results that the clinicians needed to take care of the patients. And then in 2014, we started talking about the future of automation. So now we have automated systems coming into our laboratories that are doing our microbiology setups for us and different things. And how is that new automation going to be affecting patient care? And then in 2016, we just started talking about the syndromic multiplex panels and wave PCR testing that was out there, and where did that fit in our laboratories? Who needed that? Who should be doing that kind of testing? It was in 2018 that we actually had a conference similar to this one where we wanted to talk about the culture relevance and best practices for the culture that we were still doing in our laboratory. And at that time, we were talking about urines, wounds, and lower respiratory cultures. That day, there was a lot of great discussion. The emphasis was definitely on culture. We presented those best practices. Some people were a little upset at the end of the day. We had great feedback, and we had a little bit of disappointment because some people thought they were going to come and we were going to tell them how to do things. So as I said a little bit earlier today, it's never our goal to tell you how to do things in your laboratory. We aren't going to give you procedures. We're going to tell you about options. We're going to tell you about regulations. We're going to help you decide how to make things work in your laboratory. But because all of our laboratories are different, our patient populations are different, we're never going to tell you how to do something. And in 2019, we were back to talk about syndromic multiplex panels again and more laboratory automation. Things just are coming at us and things are changing rapidly in the labs. And then we all hit the stop button because the COVID-19 pandemic was here and it wasn't safe to meet and everybody was so busy and people were leaving the laboratory. So we canceled an AST conference that LabTag had planned and was ready to give that year. And it wasn't until 2022 that we could actually hold a conference again to get back to that material. And the other thing that was so great when we were back in 2022 was just that we were back in the room. Unfortunately, at that time, you could see everybody's eyes, so it was kind of hard to tell who people were, but we were so thankful for all of the partnerships that we had developed through all of these years of conferences that we just worked so well together through the pandemic. And our hard work was recognized by Deputy Secretary Deb Standrich at one of these conferences. She gave you this thank you tour talk that she gave to all of us. But however, during the time that we were dealing with the pandemic, it didn't stop other threats from emerging. So we had antibiotic resistance taking off in organisms. That was really a big threat. And so that was why when we came back, we needed to talk about antimicrobial susceptibility testing again. But I think the best thing that came out of the pandemic is when LabTag came to us and asked us about could we honor somebody in our clinical laboratory network. And so they created the Peter A. Schulte Award. And in 2022, we had our first recipient, Dr. Raymond Podzorski. And in 23, we had our second recipient, Timothy Vu, so we're lucky to have both of those people in the room today, just wonderful people in the laboratory system. In 2023, we really took a leap of faith, and it was kind of scary for those of us at the state lab because LabTag came and said, you know, this technology is great, but we've had this loss of people with this long history and knowledge of microbiology. And now we have a lot of new people in the laboratory, and they're using automation that gives them an answer, but sometimes maybe those answers aren't right. So how do we teach people when to question what those answers are? And so for those of you that were here with us last year, you can remember it was a really exciting day. We didn't know if we were going to be getting a lot of discussion or not, but you really stepped up, and there was fantastic discussion. So hopefully we're going to repeat that today, and it's going to be an amazing day. Because we are ready to start our Performing Clinically Relevant Microbiology of 2024, we wanted to revisit the culture. We know that culture isn't there as much as it used to be, and we've got these new technologies. So what does it really look like? We wanted to talk about specific topics. So we're going to hit blood cultures today, urines, wound specimens, and deep respiratory specimens. And we're going to be talking about those types of specimens and what testing is everybody doing in their laboratory. And as I said before, we all have voices, so please don't be shy. Come up to the microphone. Nobody's judging anything here, so please participate.